Hi guys, good evening. Well, it is evening in my end. Hope you guys are doing well. Thank you so much for joining this live, and welcome if you're watching on the replay. Hi, it's been such a long time since I did a live stream. I think it's been several weeks. I don't think I did one last month. And I've been thinking I need to come back on live. There are a couple of Q&As that we need to do, but one thing after the other. But yes, I came across this story that we're going to be looking at today, and I thought this is a good opportunity to just get back in, check in with you guys, and have a conversation around cosmetic treatments. But before we get into that, how are you all doing? I'm Dr. Sylvia. I'm a GP based in Sheffield in the United Kingdom, and I'm the founder of Ask Away Health. And on our platform, we discuss everything that's related to health information for women's sexual health, families, and try to make information about your health as simple as possible, providing guidance and tips to help you make the right decision. So, of course, by way of disclaimer, I always tell you guys, I am not your specific medical provider. So I cannot provide tailored advice or treatment, but we can have a conversation around the symptoms that you have or around issues you want to talk about, and you can use that to speak with your doctor that you're registered with to get the information or the treatment that you need that is specific to your health problem. So if you check the links in the description box, which are not on the video at the moment, I will put them once I've finished. But I will share the links to our website, askawayhealth.org. And through the website, you can link up with our email health information service. So lots of different ways that you can use to reach out. I do respond to comments here on YouTube. I use comments here on YouTube as the route for our Q&As, as many of you who are familiar with our channel know. Or you can use the email service for one-to-one conversation where we can talk in more detail about any health-related issues. Before I carry on any further, my background, as you observe, is different. So we're sort of traveling and in transit, and it is a little bit noisy. So please let me apologize in advance. You might hear sounds of really loud engines going past. I'm sitting right beside the window, but hopefully we're not going to be too long on the live, and hopefully we don't get too disrupted by the sound. I'm also going to leave the links to different useful videos that you might find on different aspects of women's health. So please check out the rest of the video. And of course, the really important is please give this video a like. Don't forget to consider subscribing to the channel. You're always very welcome to join our family. I'd love to hear your comments and your thoughts really regarding anything that we talk about on the video, but it's great just to have you on board. So without any further ado, let us get into the system. Let us get into the program. Let me just share this again. I don't know Alina. Yes, I was just saying, I don't know Natalia. I wonder if I can play this without the sound. But let me see. So I don't know Natalia, or I didn't know her before now. Somehow she popped up on my feed. That is the news of her death and how she died popped up on my feed. And because we've had conversations around cosmetic surgery in the past, I thought it was a good conversation to have with you guys. And recently, remember that we had a live stream with a skin specialist just a couple of weeks ago. So in fact, my last live was not too long ago. I was telling a lie, wasn't I? So I have had a live recently, and we were discussing skin treatments, which are sort of related, because it's important that you're finding the best qualified clinician or practitioner to conduct your procedure. So whether it's skin treatment related or whether it's having a cosmetic surgery. And while we don't know the exact cause of death for Natalia, it's been investigated. We can sort of have a think around what might have happened, and that's the reason I decided to share this live stream about about her passing. So let me share my screen. with you. Give me a second. Let me share the screen. Okay. So what I want to do is just read this article just to give us a bit of background, because I appreciate that many people may not be aware of Natalia, just like I was. Like I said, it was only until this popped into my feed, and I read through, and I was really very sorry to learn about her death. So this is Natalia Cavanelas, a social media influencer and mom who died reportedly during cosmetic surgery. And she's on Instagram, but let's have a quick read. It's not a very long article, and if you Google her name, you'll find lots of information regarding to lots of different articles regarding the what's happened. So it says a prominent social media influencer and business entrepreneur has died on the operating table during a routine cosmetic surgery procedure. Natalia Cavanelas, I hope I've said that right, who boasted a personal following of over 100,000 on her personal business account and a further 30,000 followers on Instagram, is reported to have entered a Sao Paulo hospital. Oops, that's too quick. Where is it now? Yeah, she was reported to have entered a Sao Paulo hospital for the operation and developed a sudden issue that resulted in her death. A sudden issue. So this is what we want to have a conversation around, and I'll explain to you why I felt let's talk about this. CNN Brazil said the 40-year-old mother had died on the operating table on Monday, July 7th. So it'll be 2 weeks on the coming Monday since Natalia died. And it says after going into cardiorespiratory arrest during the procedure, and that the case has been registered for investigation as a sudden death. The Forensic Medical Institute's investigation into the cause of Ms. Cavanelas' death is ongoing. She's been described as a wife, mother, and entrepreneur and leader of a community of over 800 female business owners and executives. She leaves behind her daughter Manuela and husband Rafael Formazella, who has released a statement on her sudden passing. And my condolences to the family, to Mr. Formazella and the rest of the family. He talks about a lovely woman, by all accounts, beautiful, independent, super professional, happy woman, and the legacy that she will leave for her daughter. And it honestly is very, very sad. But the article goes on to say the surgeon performing the operation has claimed that Cavanelas underwent an elective surgical procedure performed in a suitable hospital setting with all preoperative examinations completed in accordance with safety protocols and medical monitoring. So that's really important. And this is where I want to narrow down for us to think about or to consider when we're thinking about treatments, aesthetic treatments, cosmetic surgery. A statement from the doctor provided to CNN and published added that the circumstances were tragic, but unfortunately, the patient developed a serious complication compatible with pulmonary embolism. There's that noise I was talking about. I'm so sorry, guys. Please disregard. It comes just for a few seconds, so we should be okay. Compatible with pulmonary embolism, a rare event, but recognized in medical literature as possible, even with all the preventive measures adopted. And his defense noted that the surgeon, has over 20 years of experience, specialized training, and always acting with ethics, responsibility, and dedication. So that is one of many, many, many articles that you will find if you look into Natalia's story. Hi, welcome to the stream. Thank you so much for joining. Please give this video a like. If you've heard of the story, or you have any insight or question, we're talking about cosmetic surgery treatments. We're looking at the very sad passing of this social media influencer, just turned 40. I understand just a few months ago, in May, just a couple of months ago. If you've got any comments, please put them in the comment section. It'll be great to hear from you. And just in case I forgot to say hi to people watching on Facebook and LinkedIn, because I'm usually a YouTube-minded person. So hi, if you're watching from Facebook and LinkedIn, you're very much welcome. Why did I want to talk about this today? Well, I have done 2, maybe 3 videos on this channel talking about cosmetic surgery, talking about BBL. I've talked about skin treatments recently, and I talk about the risks. To be very honest with you, I, like many other women, have thought about going under the knife for one thing or the other, because in the last few years it has become so easy. It is so easy. There's so many different ways, even reasonably affordable for people who want to change something they're not really happy about, the way they look. And so, yeah, I have also thought about it. And as a doctor, before I go ahead and do this or go under surgery like this, I would make sure to do my due diligence, make sure everything has been checked, and you can be sure double and triple checked beforehand. And the first thing I want to say is that I want to salute Natalia, because it seems that she did do all her due diligence. Because when you read through this, and if you go through the different articles and you read about, what's happened, it seems that every single check, we tell you about, make sure you go to a reputable center, make sure you go to a practitioner who is registered, who is qualified, who's been trained to do this procedure. Don't go and do this in backyard or quack centers. And she did everything that we would recommend. She ticked all the boxes, but something still went wrong. Why? What happened? Now, like I read, this is still being investigated, so we don't have all the answers, and we are speculating at this instance. But I would love to bring this to the attention of people who are considering cosmetic surgery to think again. And it is important that we realize that sometimes things can go wrong. And I want to talk about the things that could go wrong. And I would love to come back when we hear the results of the investigation to see, was it something that could really have been prevented? Or was this a very rare medical event that, makes this, as tragic as it is, even more tragic? So we've looked at the article. We've gotten to know who Natalia is, or who she was, and learned a little bit about her background. So let's talk about the surgery. So from the title, you would guess or know that this was a triple surgery procedure that she had. So she was having, and it appears that she was having 3 procedures within the same surgery session. That's what it appears like. So I stand to be corrected, but this is going by the reports we have in the media, that she was having 3 procedures in the same surgery session. One was a liposuction procedure. The second was what appears to be a Brazilian butt lift, is what I believe that she was also having. And the third was a breast implant replacement. So let's just go through what each of these procedures are. I know that you're probably familiar with the terms, but let's just go through. So in a liposuction, what exactly is happening? Usually the individual will be under some form of anesthesia. You'll be given some medicine, some injection to reduce the risk of heavy bleeding. And then what happens is that using a small cut into the part of the body where the liposuction is being procedure is being held or is being performed, small cuts are made, and the surgeon will use a blunt cannula to try and loosen fat, because the aim is to suck away the fat, aspirate or suck away the fat. But they first have to loosen that through cuts. And after they finish sucking out as much fat as they want for that particular procedure, they close and then use tight bandages to cover up the area that's been treated. So that's generally what liposuction is. There are some variants here and there, but that is generally the procedure. Then what about the butt treatment or enhancement, or the BBL, or the Brazilian butt lift? So there is the liposuction aspect, where they would remove fat from other areas they call them the donor areas. So perhaps from the abdomen, or from the sides, the flanks, or from the thighs, because you want to enhance the butt, you want to enhance the contour of the bottom, so you want to add fat from those areas. So first of all, they will harvest fat from that area, process the fat through a filter kind of thing, a centrifuge kind of thing, and then augment the bottom by injecting that fat that they harvested into around the muscles, or into the muscles of the bottom, the gluteal muscles, usually in small amounts at a time, because they want to avoid damage to surrounding tissues, blood vessels, and so on. And so when the fat has been transferred from the donor to the bottom, again, tight dressings and bandages are wrapped around the bottom. And then usually the people have to lie on their tummy to protect the graft until things start healing together. So that's roughly what a BBL is. I will put the link to my BBL video where I think I discussed it in a bit more detail. And then you can go and have a look if this is something that's completely new to you. And the third thing that she was having, and I believe it was in that same surgical procedure, and again, I'm taking this from the media reports. And if you're a cosmetic surgeon or practitioner and you see this and you feel, though that wasn't probably what happened, I would love to hear from you. I'm a general practitioner. I'm not a cosmetic surgeon, but I'm able to look at this and sort of infer some details from the information that's been provided. So the third procedure was a breast implant replacement. So she'd had breast implants and she wanted to replace them. Again, this is something that will be conducted under anesthesia, usually general anesthesia. The surgeon will need to make some cuts, probably along the previous scars, because if she's had an implant before, there'll be some scars from her previous surgery. They may need to remove the scar tissue, remove the old implant, and then place the new implant in the pocket. Depends, this could be simple or complicated. It all depends. You're different. We don't know specifically what Natalia's situation was, but after the new implant is put in place, then they stitch, stitch the tissues together. She has her dressing, surgical bra, and so on. So in brief, these are the three main procedures that Natalia was in hospital was having that day. Thank you so much for joining. If you're watching, thank you so much for your time. Thank you for clicking on. Please give this video a like, and of course drop a comment. Let me know what you're thinking. Let me know if you've heard about Natalia. Let me know, or just drop some condolences about her death. If this is making you think twice about cosmetic surgery, let me know. Or if you think this was an unfortunate event, you don't think it's going to happen to you, you're going to do your best due diligence, I would love to hear from you. But the conversation is around what happened, how could it have been prevented if possible, and and so on. So we've talked about the different surgical steps that she was going to have, or the different surgical procedures that she was going to have in one session. Now let's think about what could have gone wrong. And again, I would like to emphasize that this is speculative. It is because of death is being investigated. And let's now look at the key factors here. This is an otherwise, as far as we know, otherwise healthy young woman. She just turned 40. Healthy young woman. We are told that this procedure took place in a suitable hospital setting. It was in a reputable, suitable hospital setting. It was with an experienced practitioner. So my understanding of that is that this doctor has training in cosmetic surgery. It says he has 20 years of experience. I want to believe that relates to his experience both as a doctor and a cosmetic surgery specialist. I don't know which is which, because of course you become a doctor first and then you undertake further training to be a specialist in this area. So my understanding is that he is experiencing what he's doing. The other thing that's important to reference, and it should be assumed in a reputable hospital setting, but she had pre and perioperative procedure checks. So everything possible about her medical background, they knew. The anesthetist had met her before surgery, checked her allergy history, checked all the details, checked that she wasn't hypertensive. If she had any medical condition that could affect surgery, that is taken into account. Any mediation, treatment put in place before she goes on the table. While she's on the table, they ensure that she's being monitored. These are the key things that you must have in a reputable setting. So it's not just enough to have an experienced clinician or anesthetist. You need to have a center where you can have crucial perioperative monitoring during the surgery, monitoring clear safety protocols and procedures that are being followed, surgical team with the nurses, the doctors, everybody within that team should be experiencing what's going on. To my understanding, this was the case here. And that's really important because, this is what medical doctors will say, oh, make sure you get a reputable practitioner, make sure you go to a center, a facility that is experienced with this, a facility that is reliable, and so on. She did all this. But let us look at what could have gone wrong. So now, let's talk about possible things that can go on. I can think of about 3 or 4 possible things that you can't really predict that they could happen to some extent. Or if they happen, you really have to quickly react, or things might just end up as they did for Natalia. So the first one is something called the pulmonary embolism or fat embolism syndrome. And that was mentioned in the article that I read. This was something that they were already thinking that this is probably what happened. However, it needs to be investigated because there are ways that we can detect this at postmortem to indicate that, yes, this is actually what happened and why she died. But what is a pulmonary embolism and how is it related to this? How could it happen? So with liposuction and buttock augmentation surgery, that's BBL, that she had, the reason I described the procedures briefly was for you to link this possible cause of death to the procedure. So remember I said that fat is being loosened, fat is being sucked away. So there's manipulation of fat cells, and this increases the chance of the fat pieces, we call them emboli, but just think of them as fat pieces, fat cells, fat globules entering the bloodstream. And when they enter the bloodstream, that's a very dangerous situation because the blood can carry them. Sorry about the noise. The blood can carry those fat cells from wherever they were being harvested or wherever the procedure is being done very, very quickly to places, very important locations like the lungs or the brain, and that is where disaster can happen. So fat can enter the bloodstream, and it can enter the blood vessels, blocking blood supply to the lungs and causing damage to the lungs, leading to a respiratory failure and leading to loss of oxygen to the brain and leading to the heart stopping. It can happen very, very fast. By the time you realize something is going on, it might take a miracle, if you can use that expression, to reverse things. I'm not saying it's impossible, but it's a serious medical condition. And a pulmonary embolism, what people would usually complain of is sudden difficulty breathing, pain in the chest or the back. If they're coughing, they might bring up blood as they're coughing. But this is somebody who is awake and alert. Remember, Natalia was under anesthesia on the table. So perhaps they might have seen something different. Her breathing rate may have changed. Her heart rate may have changed. Her blood pressure may have dropped. So these are some of the things that might have given them a clue as to, oh, something's not right, something's going on. Perhaps that's what happened. So one issue, excuse me, is the possibility of a pulmonary embolism, that is a fat embolism going towards the pulmonary system, going towards the blood, going into the blood vessels, going to supply the lungs, and then leading to respiratory failure, loss of oxygen to the brain, and eventually stopping the heart. Another effect of fat embolism, so it can move to different organs. It can go to the lungs, it could also go to the brain. That's another effect. So if those fat lump cells, globules, whatever you want to call them, fat embolus, or emboli, if they travel to the brain, which can happen in some instances, it can lead again to respiratory failure, reduce oxygen supply to essential organs, and a stroke that can lead to death. So movement of fat, that business of loosening fat, that is a serious risk factor. It is one that, of course, the clinicians or the surgeons are aware of before they begin the surgery, and as much as possible, they try to prevent this from happening and observe for it to happen. But again, we don't know what the situation was on the table. We don't know what was happening with Natalia. It's difficult to say, but this is one possible thing that could have developed despite being in a reputable facility, being with an experienced medical team. The next thing that could happen, the next thing or the other possibility, and I said I have two or three. The other possibility is complication of anesthesia or going into anaphylactic shock. It's funny, just the other day, my daughter was asking, what is anaphylaxis? And I was explaining to her about how it is like an allergic reaction on steroids, because it's a severe, sudden, severe allergic response, and it could be a response to any drug, really, any foreign body that's introduced to the human, to human tissue, to the human body. Some people could develop an anaphylactic reaction after bee sting, after eating peanuts, after eating fish, if they are allergic to these things. In this instance, she was on the table, so we can only imagine whether she was allergic and suffered an acute severe allergic reaction to one of the drugs that was being used. And let me bring into play at this point one of the things that occurred to me when I first looked at the different procedures she was having. I was like, how long would it have taken for her to have all of these procedures? I just felt it was really strange to have all of these procedures on the same day. So if you are a cosmetic person, cosmetic surgery, or a nurse practitioner in that field, or you've had the experience yourself, please let me know in the comments section that this is not at all unusual. I'm a general practitioner, that's not my field directly, but I would question having all those three procedures on the same day, on the same table. Is that feasible? How practical is it? Those are my concerns. However, if she was under the knife or under anesthesia for a prolonged period of time, i.e. prolonged exposure to anesthesia, perhaps that could contribute to anaphylaxis or anaphylactic shock. And of course, what happens is the airway just swells and closes up, the tissues of the airway. So not just the lungs, but you're talking about the trachea, the voice box, everything just swells with fluid. And no air can get through. There's blockage, no air can get through, so there's no oxygen. It affects the blood pressure. Blood pressure drops within moments, minutes. The person goes into shock. Now, if this is something that we realize, a very common way or place that this happens is if somebody is getting an injection, for example, a vaccine, and we didn't know they were allergic to it, or somebody's having a minor procedure, all of a sudden they start to feel dizzy, or they might develop a rash, or they start to feel unwell, and we have to quickly stop what we're doing, try and put them into a recovery position, give them an injection like adrenaline to recover. That's what would happen if this was somebody who was awake, but again, Natalia was asleep while this was going on. So perhaps all they would have known was all of a sudden her blood pressure just drops. All of a sudden her heart rate and her pulse rate, they're not, they go, the pulse rate goes very fast initially. She starts to breathe very fast before things start to crash. And it can happen very, very quickly. So that's something else. I wonder if this occurred during the procedure. I might be wrong. Like I said, we're speculating. And I'm bringing this up because let us have these things at the back of our minds as possible events that could happen. So while you're looking at the experience of your team, you also want to be sure that in the case of such life-threatening emergencies, they're quick to react. Now, something else that could happen, of course, with any surgery, if you've had surgery before, you would definitely have been told, is the risk of bleeding. Whether it's a C-section, whether it's a myomectomy, whether it's tonsillectomy, whether it's repair of a fracture, hip replacement, and so on. Bleeding is a well-recognized and known surgical complication, and why they take so much time, surgeons, to learn the anatomy of the specific areas that they are specialists in. So, for example, a knee surgeon has to know extremely well the anatomy of the knee, because they need to know where the blood vessels and nerves and so on are located, so that when they're trying to repair knee problems, they are not going to cause more harm, and they're able to protect these delicate organs during the procedure. However, bleeding can happen with any procedure. Remember how I described liposuction, BBL, even the breast implant replacement. There's a lot of tissue handling and movement, it is not impossible that blood vessels could be damaged by accident, or just simply the procedure is accompanied by bleeding. And if the team, the doctor and the team haven't controlled the bleeding properly, that could cause a serious problem, because that bleeding, that loss of blood will affect the blood pressure will drop, and that leads to shock. Again, that is something that can cause death on the operating table. The same with the breast implant replacement. It might sound so simple: bring out the old and pop in the new, but you're trying to remove the scar from the previous surgery. For some, it might be simple. We don't know how long ago it was she had the previous implant. It might have been difficult to do so. We don't know. It could have been associated with bleeding. So massive bleeding around the surgery can lead to shock, hypovolemic shock, we call it, different from anaphylactic shock. And if that's not recognized and controlled, that definitely can lead to death. Two other things actually that I thought might happen. And this is interesting because I know we've just finished talking about heavy bleeding, but there's also the possibility of something called fluid overload, loading too much fluid into the system. You're trying to protect the individual, but by some error or something happens, an excess amount is put into the body. See, these procedures where you're moving fluid, fat, transferring fat from one area to the other, you need to be sure that you're managing the individual's fluid balance. Our bodies manage fluid balance all the time. The reason that we tell you when it's hot weather, as it is in many parts of the world at the moment, drink plenty, is because we know that we're going to lose fluid by sweating. We're going to much more than we would normally lose during other times when the weather is not too hot. And we tell you to drink as much, stay hydrated is the catchphrase for the moment, because you don't want to mess up the fluid balance. Fluid balance is so important. That's the same reason why when somebody has a stomach bug with vomiting and diarrhea, one of the key things is oral rehydration, because you want to put back the fluids that are lost. So what do I mean in this instance? How is it related to the liposuction and the BBL? Large volume liposuction can cause shift of fluid. If you've had this procedure before, you would definitely confirm that they put you on an intravenous drip, because they want to give you injections, of course, but they also want to make sure that your fluid balance is maintained throughout the procedure. Because while you're moving these pockets of tissue, pockets of cells, you can't just leave a vacuum. Fluid is going to be moving from one compartment in the body to another. So if the fluid replacement is too aggressive, because the doctor or the anesthetist is trying to manage the fluid balance, if it's too aggressive, they may push too much fluid into the system. That fluid will travel in the blood circulation to the lungs and cause something known as pulmonary edema, more commonly seen if somebody has like a pneumonia, or if somebody has heart failure, where there is a lot of congestion within the lung tissue. It could affect the breathing, make it difficult to breathe, and then it can also lead to shock, and that can lead to death. So that's another process or problem, potential complication that might have resulted in the death of this young lady. And something else that I came across when I was sort of studying to see what could have happened. The fact that she was having the breast implant, and this might be rare or not so common, but it could have resulted in a vagal reaction, because they're doing a dissection, trying to remove the old implant. It might affect the vagal nerve. The vagal nerve is one of the very big nerves that's coming from the brain, and as it comes out from the brain, goes down towards and divides down the rest of the body, shooting off different branches. And the vagus nerve is so important in different activities. It's related to our blood pressure, related to pulse. In this case, it may have affected her heart rate and caused the heart rate to drop very low. And that, again, if it's something that's not picked up early, if it's not controlled, could also cause death. So these are, was it 4 or 5 things that I thought could have happened? But I feel the most important thing is, please don't just assume that, well, because the surgeon is an expert, because I'm a healthy person, I don't have any pre-existing medical problems, because it's a reputable center, that things still can go wrong. It's really important that men, people, I said men, anyone, men, women, anyone deciding to go for any of this kind of surgeries, keeps this at the back of your mind. Now, I know you're going to say to me, well, it's surgery, these things could happen. I agree. I just finished a video last week or 2 weeks ago talking about the fear of surgical procedures. And I know that there will be somebody in the comment section at some point saying, well, this is why I don't want to have surgery. And I understand that. But remember at the beginning of this video, I said these procedures have become so popular. They become really within reach of many, many people, whether it is in our home country or whether we're traveling abroad to have these procedures. For example, I'm Nigerian by birth, and in Nigeria, there are many women who we have lost as a result of cosmetic surgery procedures and their complications. And there could be different reasons, whether it's from inexperienced clinicians or from facilities that were not well equipped to look after them, or those that traveled abroad to have their procedures and things went wrong. Even here in the United Kingdom, we're still recovering from, there was a young lady, I can't remember her name now, but I think she went to somewhere in Manchester, I can't remember, to have her procedure. And it was specifically one of these people, I will not call them clinicians, who maybe have had 2 days of training, 2 days training, and then they feel that they are well equipped to treat people with potentially serious medical procedures. And of course, this woman lost her life, left, I think, 3 children behind. And so it's very sad. And the reason that we're having this conversation is to say, look, we really need to sit down and think very clearly about undergoing these procedures. It's not just enough to do the due diligence in terms of the abilities of the surgeon and the facility you're going to. I would also question the length of the surgery, why they had to have 3 different procedures at the same time, because that seems to be what's coming through. So I would really want to question that and ask as many questions. And some people would say, why do women put themselves through this? Why aren't you happy with the body that you have? Why don't you do this, do that, or the other? And I completely appreciate that. And I'm not going to use that specifically as my argument. I think that people are in different places and may want to take certain decisions about having this kind of procedures. And if a person, they have their own autonomy and they choose to, if I choose to, I've told you, I've thought about having this kind of procedures before, going under the knife to sort out 1 or 2 things I think could look better about myself. So it's not to look down on anybody and say, oh, you're just focused on beauty or things like that. I think I would respect somebody's wishes, but I would want to make sure that you take the very best advice about potential complications and discuss how they can be mitigated, they can be prevented. The first one I will come to in this particular event is, why did they have 3 procedures at the same time, 3 different surgery at the same time? I want to believe that perhaps we've misread the article and perhaps they didn't have the 3 procedures at the same time. Who knows? I don't know. It'll be great if anybody has any information to share. But guys, this is what I wanted to talk to you about with this situation with Natalia. Again, my very, very deep condolences to her family. And I think they've clearly lost somebody that was very, very well loved. She had a thriving business, I'm told, and was a recognized member of the business community in Brazil. So there'll be lots of pain, and I think if you go through our Instagram pages, there are lots of people leaving tributes, and it's a very sad thing. So I know that there's a little girl that will grow up without her mom and have to come to terms with something that sadly happened almost 2 weeks ago. But my deep condolences to the family, and my hope that God will comfort them and help them to live with this situation. If you have any questions on this subject and you want to, just sort of have a further chat about things, or help to settle your mind about things, or clarify things in your mind, please let me know in the comment section, or use the email health information service on www.askawayhealth.org. I'm always happy to hear from people. Look out for the next few videos that will be coming up on the channel. I can't remember specific topics, but I think there's some on HRT, care after a C-section, using the birth control with Monjaro. So some of these videos that are going to be coming up, please look out for them. Thank you so much for the support that you always give to the channel. Much appreciated to channel members, those that like and comment. All this engagement is amazing. I am truly grateful. You guys have probably noticed that we're heading very smoothly towards 100,000. I'll be so happy if we could hit that milestone this year, before the end of this year. It will be amazing. So yeah, thank you so much for joining. Have a very happy Saturday, or rest of your Saturday. Actually, I think it's probably Sunday in most places already. I'm not 100% sure. If I get ready and I have enough time, I will come back tomorrow to do at least one or two questions for a Q&A live stream. So watch out for my notification, watch out, and if you're interested, because there were some really good questions that I thought, wow, I really need to talk about these questions on a live stream, and I've just been sitting on them for a few weeks because it's been so busy and one thing or the other, but hopefully I might have the chance to do so. Thank you so much for watching. Don't forget to give this video a like. Don't forget to subscribe to the channel. Always good to see you guys, and I will be with you again soon. Take care. Bye. Feeling unwell but dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare should work for you. Visit our website to book your consultation today.